So let's talk about the oral cavity and how food moves from the oral cavity towards the stomach. So the oral cavity is your mouth. This is where ingestion takes place. So we could talk about ingesting food. We take food into the mouth and then we manipulate it. One of the things that happens after ingestion is we have mechanical breakdown or mechanical digestion. We talked about the teeth as being an important role of breaking that food down to create the surface area over which the enzymes can take place. Okay. We also have manipulation of the food with our tongue. So we have the tongue located in our oral cavity, and it has two different types of muscles in it. The intrinsic muscle changes the shape of the tongue. And this intrinsic, this is all skeletal muscle. This intrinsic muscle changes the shape, and it is actually not attached to the skeletons. It's not attached to like your jaw or your hyoid or anything. It's just allows the shape. So your tongue can get thick or get thin. Okay, then we have the extrinsic muscle, and this actually moves the tongue around. So sticking out your tongue is the extrinsic. And the tongue actually aids in moving the food. It actually has a rather rough surface because of the filiform papillae on the surface of the tongue, but it also kind of moves food underneath your teeth, and your teeth can mechanically digest the food. It also is really important because it forms a bolus. And so we have a bolus, which is a ball of food. And this bolus is what is going to be swallowed. And it's very important that we swallow our food carefully instead of inhaling it, because we want it to actually press down on the epiglottis so it bypasses the trachea and will go into the esophagus. So the tongue helps in manipulating and creating a ball of food. So when we talk about the breaking down because of the teeth, we have, this is chewing by the teeth, and this is called mastication. So mastication is chewing your food. Swallowing it is called deglutination. So when you swallow, that's deglutination. So you're swallowing the food. So if we look at the accessory structures to the alimentary canal, your oral cavity, remember that we do have salivary glands. So that's not the picture of my salivary glands, my salivary glands. So the salivary glands are very interesting. We have large ones up here that actually get infected by the mumps virus and can cause a swelling of your face if you have mumps, if you have a mumps virus. Then we have some that are sublingual underneath the tongue, and then submandibular underneath the jaw. And sometimes those can get sore, but remember that we also have lymph nodes in the neck that swell up when we're sick. So these have ducts. They're examples of exocrine glands. So my salivary glands are exocrine in function. They have ducts, and these ducts end up delivering their stuff into the oral cavity. Saliva has enzymes in it that help to break down the food. It also moistens the food. It also has antimicrobial properties. So like when you have a wound and your first impulse is to suck on it, right? That actually has antibodies and lysozyme enzymes, which break down bacteria. So it's not a bad idea to use that if you don't have the ability to wash a wound immediately. So if we look at the inside of the mouth, here is my tongue, a big muscle. You can also see associated with this structure, these are my lymphatic tissue, my tonsils, which help to protect us from infection. Notice that underneath the tongue, we have openings. The submandibular duct of the salivary glands can shoot saliva out, right? And then we have this structure right here, which is called the lingual frenulum. It attaches the tongue to the base of the mouth. And this is really important because sometimes, specifically, babies are born and they're said to be tongue-tied. And that means that their lingual frenulum is inhibiting their movement of the tongue. And this can actually be problematic if a baby nurses, right? So they have to use their tongue to nurse and to suck on a bottle and also to speak and to make sounds. So sometimes babies have to have that lingual frenulum cut so that they are no longer tongue-tied. Okay. You'll also notice that we have a frenulum that attaches to the lips, top and bottom is a little piece of tissue, which is also called the labial frenulum. Okay, so food, when we swallow it, it actually doesn't go right to the esophagus. It goes into this common opening, which is called the pharynx. We could accidentally, when we vomit, sometimes we could get food going up into our nasal cavity, but we don't want that to happen normally, right? It needs to go down. So we swallow, and then we force this structure down, which is called the epiglottis, and it closes off the glottis, which is the opening to the trachea. So we want food funneled here, right? If it goes in there, it can completely block your airway. And then we have the Heimlich maneuver, which is like forcing compression and forcing food to pop out of the trachea, right? So we don't want to choke and die on food that was improperly swallowed. Okay, so from the oral cavity, this is transferred food bolus. Food bolus is transferred to the pharynx, which is the common opening of the respiratory and digestive system. And then it goes to the esophagus. So the esophagus, like the oral cavity, like the pharynx, is actually lined with stratified epithelial tissue. So we have stratified squamous because of the possible friction. Anytime in our alimentary canal that we have friction, we need it stratified in order to protect the tissue. So when we look at our digestive tract, right, when we look at our entire digestive tract, we see here that we have the esophagus coming down. It goes down behind the heart, and it is actually having to go through a structure called the diaphragm. So the diaphragm is actually part of your respiratory system, but the diaphragm is important in breathing, but the esophagus actually has to puncture that opening to get to the stomach, which sits below the diaphragm. Okay. So one of the interesting things about the esophagus is it has smooth muscle that causes peristalsis. Peristalsis. And so this is a wave of contraction due to the smooth muscle that forms the circular layer and the longitudinal layer of our alimentary tract. So one of the things that's interesting is when after you swallow, your esophagus takes over and it is involuntary and it squeezes and relaxes and squeezes and relaxes, and it's forcing the food down this tube and into the stomach. So that contraction, the alternating contraction and relaxation can sometimes be felt if you get something stuck in your throat. So let's say you take a vitamin and it's one of those capsules that's sticky when it gets wet and it adheres to your side of your esophagus. You might notice that you feel it like trying to force it down and it is unable to do that and it becomes annoying. So you might drink some water or eat some food to get that unstuck, right, from the esophagus. So the esophagus has this peristaltic movement. So you just need to know, I'm not going to talk about segmentation, which is up and down, but peristalsis is just going to be a wave of contraction and relaxation that moves the food towards the stomach. Okay. So once it gets to the stomach, we need a valve because we don't want stomach acid getting back up into our esophagus. So we have what is called the gastroesophageal sphincter. And so if you break this word down, gastro means stomach, esophagus. So this is the sphincter. It's not really they call it a physiological sphincter, but it is actually kind of where the diaphragm helps to close off the opening to the esophagus as the esophagus goes through it. And so this gastroesophageal sphincter prevents stomach acid from getting into the esophagus. And we maybe have all experienced when it does, and it is very painful. And the reason for that is that our esophagus is not designed to handle the stomach acid. So it actually damages the esophagus. And if left unchecked and you have chronic heartburn, it can actually lead to esophageal cancer. So this prevents what doctors now call, instead of heartburn, they prevents gastric reflux. Acid reflux. So from stomach acid getting into the esophagus.